So my hello to all the viewers here. I think today we are here to connect on YouTube once again. This is Thursday's 10. We are doing a series. Today is the fourth and the last day of the series. Monday motivation, Tuesday short MCQ, Wednesday vision, where I discussed an image of EEG interpretation yesterday, and today is the last day of this session. This week was psychiatry week. So today I am going to discuss 10 most important MCQs in psychiatry for NEET in the next 20 to 30 minutes. Are we all connected? Can you hear me? The people who are there in the live in the chat, am I audible? Hi Swastika, can you just confirm whether I'm audible? All right, thank you so much. Let's begin. So I've selected some MCQs. Most of these are repeat questions only, but there's a topic I want to discuss with you. Suspected opioid overdose comes to the emergency room with respiratory distress, bradycardia, hypotension. Please remember, drug of choice for opioid intoxication, that is overdose, is naloxone. Drug of choice for opioid de-addiction, anti-craving, is naltrexone. Are you getting my point? Drug of choice for maintaining long-term abstinence, OST, opium substitution therapy. What is the opium substitution therapy drug? Come on. Opium substitution therapy drug. Come on. Yes, Dr. Stephen, we are planning to cover some more subjects like this. These are two drugs, methadone and buprenorphine. Methadone and buprenorphine. Buprenorphine is mu receptor partial agonist. This is the major OST for IV drug users, that is heroin users. When this question came in actual NEET exam, some student got confused between naloxone and naltrexone. Naloxone and naltrexone both are opioid antagonists, but naloxone is used for opioid intoxication and naltrexone is used for opioid anti-craving, de-addiction. Do you understand this? Do you understand this? Current year NEET PG question. Flumazenil, it is drug of choice for, come on, benzodiazepine overdose. For alcohol, we have methyl alcohol poisoning, that is fomepizole. Got it? Now, next question. A patient was having obsession, thought insertion, derailment, and delusion of persecution. NEET 2021. This question comes categorized thought disorders. Which of these is included in form of thought disorder? Derailment, also known as loss of association. It is a disorder of form of thought. Obsession, it is a disorder of content of thought. Delusion, it is a disorder of possession of thought insertion, it is a disorder of possession of thought. Delusion, it is a disorder of content of thought. Answer was A, derailment. Were you able to answer this? This is a very important question. You know, I have selected these questions from all the previous year questions so that I can tell you what are the important areas. Are you following it? Are you following it? For those who do not have this chart, please take a snapshot of this particular slide. It's a very important chart. Thought disorders. Loss of association or derailment was asked in NEET 2021. Neologism has been asked. Obsession has been asked in AIIMS and INICT. Possession includes thought insertion, thought withdrawal, and thought broadcast. Stream include flight of idea, prolixity. Prolixity means ordered flight of ideas. It also include circumstantiality. It also includes tangentiality. It also includes clang associations. Do all of you have this in your notes? Even whether you are a DAM student or not a DAM student, I'm sure all the teachers everywhere, all the books have given you this chart of thought disorder. Do you have this chart with you? Mark it as a VIP chart. You know the time to the exam is nearing. So at this time, we cannot afford to read something which is not important. Rather, we are going to read something that is most important. So do you agree this is a high yield chart? Do you know this chart? Yes. Today I have only 30 minutes to cover the 10 most important MCQs. Just imagine I am myself an author of Psychiatry question bank for last 4 editions. I have myself framed more than 1000 MCQs so far, taken so many test series, T&D, subject-wise test. Why I am taking only these 10 MCQs? Because I believe if a student has only 30 minutes to read Psychiatry, he or she should read these 10 MCQs. So these are the important questions from a teacher's perspective. Please pay attention. Which of the following is not seen in a patient with a heavy dose of cocaine intoxication? Now please understand, cocaine, its action is it increases norepinephrine and dopamine in the brain. This is the action of cocaine. So when it is intoxication, so it will cause tachycardia, hypertension, delusions, hallucination. While when cocaine is withdrawal, it will exactly cause its opposite: bradycardia, hypotension, depression. So the answer is bradycardia. Do you understand this concept? So if the action is, let's say, this intoxication will be exaggeration of the action and withdrawal will be reverse of the action. Do you understand this? Do you understand this? So they have asked cocaine, they have asked alcohol, they have asked opium, they have asked cannabis, they have also asked nicotine. These are the 5 most important substances for your exam: alcohol, opium, cocaine, nicotine, cannabis. You must know intox and withdrawal of all of this. I am highlighting the key points, key areas which you are supposed to do in psychiatry. I hope it is helpful. Question 4. This was a new question asked in NEET 2008-19. Although the students were able to mark the answer because confusion is the other term for delirium. The students were knowing the scale in dementia is known as MMSE, but the scale in delirium is known as confusional assessment method. The scale in depression is known as HAM-D, Hamilton Depression Rating Scale. The scale in schizophrenia is known as PAN-SS. Positive and negative symptom scale. So they have already asked CAM, they have already asked MMSE. They may ask you HAM-D and PAN-SS. Are you noting it down? I suggest you to take a pen and paper and scribble. The scale in OCD is known as Y box. Yale Brown Obsessive Compulsive Scale. So far in our exam, they have only asked MMSC and CM. But I'm just telling you 3 more scales name just for the purpose if they can ask it in future. Do you understand what I'm trying to say? Alright, thank you so much. Stereotype is best defined by which of the following? Would anybody wish to answer this question? Stereotype is best defined by which of the following? First of all, these are repetitive movements, so not non-repetitive. These are voluntary movements, not non-voluntary, but these are non-goal directed. The repetitive voluntary goal directed movements are called mannerisms. This is the definition of stereotype asked in NEET 2018. Repetitive voluntary non-goal directed movements. Goal directed means purposeful. Non-goal directed means non-purposeful. Done? 6. As per American Psychological Association, what is the new term used for mental retardation? Come on. New term used for mental retardation. Intellectual disability. Previously we used to call it as mental retardation. Nowadays we call it as intellectual disability. Previously the severity was given on IQ levels. Nowadays the severity is given on adaptive functioning. What other diseases are known by different names? ADHD is also known as minimal brain dysfunction. Again asked in the same NEET. Hypochondriasis is also known as illness anxiety disorder. Dementia is also known as major neurocognitive disorder. Schizophrenia was also known as dementia precox. So I suppose you remember these alternative names kindly. Are you noting it down? Most of you know these names. So there's a trend to ask name-based questions in psychiatry. I hope you have followed up to this. Next question. Which of the following best differentiate delirium from dementia? Again, a frequently asked question. Delirium is acute, dementia is chronic. Delirium is fluctuating, dementia is mostly progressive. Delirium remote memory is normal, dementia remote memory is lost. Suppose they ask which of the following cannot differentiate delirium from dementia, the answer would have been B. Suppose they ask which of the following can't differentiate delirium from dementia, what would the answer have been? Which of the following can't differentiate delirium from dementia? Answer is B, because all three others can differentiate. Suppose they ask which of the following best differentiate delirium from dementia. The ideal answer of this question is altered sensorium. That is disorientation. But unfortunately, when this question came in the exam, altered sensorium was not in the option. So which is the next best to differentiate? Anybody who can answer? After altered sensorium, the next best to differentiate is fluctuating course. This question was marked in the exam by some student as A, acute, some students said D, remote memory, but the best answer after altered sensorium is fluctuating course. Got it? Question 8. Again, this question was marked wrong by some students. Patient of depression was started on imipramine. Imipramine is a tricyclic antidepressant given for 2 weeks. Relatives noticed new symptom like being cheerful, increased excitement, wearing of color clothes. This is a case of drug induced mania. Because the patient was given on antidepressant, suppose the patient comes to you with depression, obviously you will give antidepressant, but antidepressant resulted in drug induced mania. What should be the first step in drug induced mania? Continue antidepressant or stop antidepressant? Continue antidepressant or stop antidepressant? Stop. So these are not the answers. If you discontinue imipramine and start fluoxetine, fluoxetine is itself an antidepressant. So it's better to stop imipramine and start sodium valproate. Were you able to answer this question? Were you able to answer this question? It's an important question. I expect this can be repeated. Out of 37 questions asked in NEET in last 5 years, I have discussed 8 questions here which are the most important. Have you followed up to this? Have you followed up to this? Visual hallucination are most predominantly seen in Lewy body dementia is the most important dementia for your exam. This presents with fluctuating levels of cognition. Otherwise, dementia is progressive. The only dementia that is fluctuating is Lewy body dementia. It is the second most common dementia in elderly after Parkinson. No, after Alzheimer. As per ICD-11, it is the second most common cause of dementia in elderly. This dementia is characterized by visual hallucination. This dementia is characterized by movement problems. That's why it is just like Parkinson. In this dementia, antipsychotics are contraindicated, and the patient may have REM sleep behavioral disorder. In this dementia, patient may have REM sleep behavioral disorder. So there are 5 points about Lewy body dementia that you need to remember. Number 1, fluctuating. Number 2, second most common. Number 3, visual hallucination. Number 4, movement problem, antipsychotic or contraindicated. Number 5, REM sleep behavioral disorder. What is REM sleep behavioral disorder? Normal REM has muscle atonia. In this, there is no muscle atonia. No muscle atonia. I'm planning for such more revision videos and revision sessions on Instagram, my YouTube channel, DAMS Delhi YouTube channel. Even I'm planning a one slide every day type of revision test series, revision flashcard series on Insta, Telegram groups, WhatsApp group, Facebook group of DAM, Facebook page of myself. So from 1st of January till 1st of March, every day I'll post one slide with high yield content. You have to just devote 5 minutes to psychiatry, because my subject is just worth 4 to 5 questions out of 200, maximum 5 to 6. So for those questions, there's no separate time allocated to psychiatry. Even then, you can finish this short subject in one day. Morning you start, evening you finish. Just make sure you focus on more of the drugs part, psychopharmacology, rather than the clinical part, because the drug based questions are more asked in the exam. I'll be sharing one slide every day, and you have to make a compilation of 60 slides, and just see that those slides will not be images, these will be content. Just like Lewy body dementia, one slide, schizophrenia important points, one slide. You have to save those slides and just see it once before exams. All right, last question. Most common symptom associated with adult OCD. Overall, most common is dirt contamination. But in this AIIMS question, dirt contamination was not in the option. So the second most common is pathological doubt. In dirt contamination, the corresponding symptom is washing. And in pathological doubt, the corresponding symptom is checking. Although dirt is more common than doubt, but most common compulsion, if they ask, checking is more than washing. Checking is more than washing. Ten most important disease in psychiatry are: number 1, OCD. You need to read the management. Number 2, depression. Again, focus more on management and special forms of depression, like postpartum depression, atypical depression. Number 3, schizophrenia. In this, maximum questions are coming on prognostic factors and subtypes. Number 4, hypochondriasis. The only question that comes on hypochondriasis is its diagnosis. Are you copying this list? Number 5, dementia. The maximum questions are coming on subtypes. Are you copying this list? I have 2 minutes left for this session today, so I thought I should give you a list. 10 most important disease in psychiatry. Number 6, panic disorder treatment, mainly drug of choice. They have asked drug of choice many times for panic. Number 7, phobia. Maximum time they'll ask you a question on subtypes of phobia. Agora, social, specific. Dementia subtype as in Alzheimer, cortical dementia, subcortical dementia. Number 8, bipolar disorder. In bipolar disorder, they will always ask question on management. Very rarely on diagnosis. Number 9 is conversion disorder or hysteria. They will always ask question on diagnosis. How to diagnose conversion disorder. And last but not the least is eating disorder. They will ask you a difference between anorexia nervosa and bulimia nervosa. Keep this slide with you. Copy it. When NEET exam will happen, I'll ask you how many questions came from those 10 diseases which I told you to study and read. So the revision series will continue on YouTube channel. Revision series will continue on Facebook. Stay connected with us. That's all about today's session. Wish you all the best for exams. I hope my session was helpful. Okay, thank you very much. Here I end today's session. I would love to hear feedback, comments, suggestions from you. Thank you. Bye bye.